Good evening, everyone. Thank you for responding. We've already done that. So my name is Jessica Jolly, and I'm a graduating Master of Public Health student in Health Behavior Health Promotion here at OSU. I am from Detroit, Michigan, and spent 3 years before graduate school teaching disadvantaged minority students in Atlanta, Georgia, in one of the most impoverished neighborhoods there. It was during this time that I had realized that my students were missing school, struggling academically, and failing or falling behind due to poor health associated with limited access to health care. My experience as a Teach for America Corps member heightened my desire to eliminate health disparities and achieve health equity, and inspired the creation of the Centering Family Health Program, my Albert Schweitzer Fellowship project. As an Albert Schweitzer Fellow, I address chronic diseases including cardiovascular disease, stroke, diabetes, cancer, COPD on the Near East Side of Columbus, Ohio. I implemented the Centering Family Health Program, a school-based comprehensive family health and wellness program with 12 low-income families during the 2013-2014 school year. I partnered with Eastgate Elementary School to provide health education, social support, healthcare to improve the health status of participating families. Over the past year, I've had so many memorable experiences that it was quite hard and difficult for me to decide which one I should share with you all tonight. But as I went through my mental Rolodex of memories, the experience of the Woods family was one that I had to share. My first encounters with the Woods family was when I called Daniela Woods, a wife and a mother of 3. Daniela was very hesitant about joining the Centering Family Health Program because participating in the program would mean that she would have to rearrange her work schedule, which was quite difficult for her. After explaining the program in detail to Daniela, she decided to participate. I was extremely nervous because I wasn't quite sure how beneficial the program would be, meaning and seeing that we just started this program. But she thought it would be a great idea, and she decided to join the program. For the Woods family, the benefits of participating proved very worthwhile. First, six-year-old twins Charles and Charissa, by the end of the program, were able to explain the chronic illnesses reviewed and list 3 ways to prevent them. Charles explained, "Learning about diabetes is kind of important so you won't die." Charles also made a public service announcement. "Try to avoid diabetes, and if you have some, go to a doctor and see if he can help you." That made me laugh when I watched that video. So Charissa chimed in and said, "Try to avoid diabetes." And then Charissa chimed in and said, "Or she," to remind her brother that girls can be doctors too. About the program overall, Charles said, "I like the Centering Family Health Program because I learned how to be healthy with my sisters and my parents. And I am especially happy that my dad came too." After meeting nurses and doctors over the course of the year, Jerica, Daniela's 17-year-old daughter, was accepted to OSU and is considering a career in OBGYN or becoming a nurse practitioner. So after a recent project or event, Daniela stopped me and said, "Jessica," with tears in her eyes, "Jessica, thank you so much. You just don't know how much you changed my life. I would have never done any of this if it wasn't for you in this program." Daniela came to this program as a smoker with poorly controlled diabetes, and I'm very happy to report that today she's no longer a smoker, and she significantly changed her diet. So thinking of all the things that the Woods family accomplished, I had to hold back my tears, and that was the moment that made it all worth it and validated all the time and energy that I put into planning this program. My fellowship experience was one of the most fulfilling things I've ever done, and I have always strived to make a difference, and I'm so blessed to know that I've made a difference in the lives of these 12 families over the past years. So in closing, I would like to say thank you to my site mentor, Eastgate Elementary School Principal Cynthia Ball, my academic mentor, Dr. Elizabeth Klein, and my career mentors, University Hospital East administrators Elizabeth Seeley, Diane Gordon, and Dr. Mary Howard. I'd also like to thank Chip Bond for all of his hard work and all of my volunteers' hard work over this past year. And last and most importantly, I want to give God thanks, because without him, I really couldn't have done this. It took a lot of time and energy. And so I'd like to say thank you, and I truly enjoyed being a Schweitzer Fellow this year. Thank you.